I was diagnosed with Hodgkin's disease lymphoma when I was 17 years old. I found out the day after Christmas, my senior year of high school. And so I chose to be treated as a child and picked to go to Mary Bridge Children's Hospital. When I finished my treatment, it was May, June-ish of 2008. I had just graduated from high school, and it kind of directly coincided with my graduation. And so I went off to college in Idaho, like I said, but when I was in Idaho, I realized really quickly that I needed follow-up care, and I had nobody to give me that care. So the services that the long-term care clinic can give to people is incredible. I feel like having the opportunity to talk to people about all the different things I've experienced since having cancer has been a huge benefit to my overall health.
Our survivorship program is actually named after Pano Kamantros, who is his family very graciously donated the money that's made our program possible. We actually started in 2015 when I first started working here. Survivorship is a really big passion of mine and has always been. It was actually one of the big reasons why I went into oncology. And so I came here, and one of our other nurses was extremely passionate as well. And we started the program. It was just her and me, and we just started seeing patients on our own. And I could probably see maybe about 15 to 16 patients a year. And then with donor help, we were actually able to really grow our program significantly. In 2019, we were able to see actually up to about, it was like 58, 59 patients rather than the 15 or 16 that I could do before. We hired a nurse practitioner. We got additional administrative help. There's actually hours of work that go into preparing for every single patient who comes in through our clinic. It's probably on average about 4 to 6 hours of going through the patient's original chart and notes and actually preparing a summary of all of the treatment they got before. Then I actually, or the nurse practitioner, whoever the provider is, will put together a summary of all the recommendations that are needed and required from the Children's Oncology Group to actually deliver care for those patients. And then the actual day we go in, the patient will be actually seen by either a nurse practitioner or myself, our social worker, child life specialist, dietitian if needed. And what's really been incredible lately, we've been able to actually bring in one of our neuropsychology team members to come in and actually do screening on every single patient. So every single patient who comes through our program gets neuropsychology and psychology screening. And if they need additional therapy or treatment after that, they're referred immediately. So it's actually pretty wonderful. There's actually a large educational piece of what we do for every patient. So our nurse navigator and our survivor nurse actually go in and meet with every single patient as well. So each clinic visit takes on average 1 to 2 hours per patient. We spend a lot of time with every single patient. I think that there's so much, kindness and energy and support when kids and families are going through treatment for cancer. We don't often recognize that so much work has to happen afterward. And that often is the time when families and children and young people need even more support. And so I think that's where this program is extremely powerful.
I feel really grateful to be alive. I feel like I am only alive because of the generosity and the research and the support of other people. I feel like so many people came before me who weren't as fortunate. I would want people to know that the work that they do and the money that they are able to contribute, but just any way that people can contribute to the effort and the cause, it matters. And it's not just me. I've lost a lot of friends along the way, and I know though that people coming and being willing to give to the cause makes a difference. And I know that this clinic can make a difference to so many people who are personal friends, and they're not just numbers on a board or things like that. They're my friends and I can name them and they matter. And so the fact that they're willing to give means a lot to me.